Well, welcome back to part 2 of our discussion about our time at Arab Health. And we were talking about genomics and all the programs that we are seeing in the region. They focus quite a bit on the research. We even hear much more talk about preventative care. But can you talk about how we take that to more precision diagnostics, precision medicines, how genomics is now more at the heart of patient care, which I think is where it should be?
Excellent question, Christina, because genomics is such a complicated subject, at least to us lay people, us lawyers. And we always imagine theoretical research in laboratories. And the question is, well, how do we bring that back to patients? And how can we show improvements in patient outcomes through the use of genomic research, genomic screening? And an excellent example of this is how we are going to reimagine cancer care and the delivery of treatment to cancer patients. We heard some very insightful comments from Professor Angela Jones from the Royal Marsden Hospital at the Cancer Summit held yesterday, where she explained we think of cancer in terms of our organs: breast cancer, prostate cancer, lung cancer. Actually, we need to look at cancer at a molecular level, and in order to do that, we need to understand our genetic makeup and how our genetic makeup influences and predisposes us to developing cancer cells in our bodies, not particularly in relation to an organ. And we also have to consider how this impacts in terms of hereditary and family history. If your mother had breast cancer, will you develop breast cancer? That's how we've looked at it in the past. But now actually we're saying, what's our genetic makeup? Does our genetic makeup predispose us to certain cancers rather than whether a family member has had it? Of course, that is also significant. Once we've mapped our genomes, we then have the data related to that and hundreds and thousands of other individuals and families. We're then in a better position through the use of artificial intelligence and the diagnostics that machine learning is capable of delivering to understand how cancer is going to affect all of us at a molecular level. We can then determine what screening we need within individuals, families and populations, and we're then able to target preventative therapies and medicines for cancer more accurately than waiting until it's too late. And in that way, we are then putting the patients back at the centre and actually delivering better patient outcomes through using the research and the data that we hold.
So you touched upon something that we've heard throughout, another theme throughout the conference is AI and the use of that in clinical practice. And something I heard and I agree with is, at what point is the non-use of AI in clinical practice going to be considered malpractice? And I'm not sure there's an answer, but I think it's a bit food for thought.
I think that's a difficult question for lawyers,
of course,
and for medicine and for science. Now, of course, AI is going to be important because we will generate so much data through the use of AI that we need to manage that data and manage how we're going to use that data in order to deliver better patient outcomes. Of course, the outputs through the use of AI is only going to be as good as the data inputs. The origin, the source of the data, the accuracy of the data, the quality of the data, the age of the data. All of those factors are going to be important for that AI machine learning to provide some outputs. Ultimately, however, AI is just one diagnostic tool amongst other diagnostic tools. Yes, of course, the clinicians will be more encouraged and need to use AI as part of their clinical practice. Not using AI if it's been determined to be best practice in a particular country might be seen to be poor clinical practice. There will be standards of practice delivered across every kind of medical practice, whether it's cardiology, endocrinology, and so on. And so not to use AI, I think, will be a lost opportunity, a missed opportunity. But equally, the other side of the coin is it would be extraordinary if AI were the sole determinator of a diagnostic indicator for a patient.
I agree. I at least not now. I don't think they fully take the job of the clinician, but rather support it. And maybe it's more looking at it from a decision to support to than a diagnostic tool in and of itself without any further review or support. But yes, something that we get to debate in not only the research and clinical setting, but also in the legal setting. We had the pleasure of having Dr. Iptason on our panel, being the Director of Partnerships and PPP at the Dubai Health Authority. And she highlighted that 80% of the healthcare system in Dubai is private sector. It's very different than the rest of the region, where it's quite the opposite in terms of government versus private sector run. And the DHA had a guide, an investment guide, I think last published in 2018, I think. But this year, they've just done an update to it where they looked at capacity planning, supply and demand gaps, PPP opportunities, just a wealth of information. I think you were on the panel with her. Can you tell us a little bit more about your conversation?
Yeah, certainly. What an extraordinary individual she is, spearheading the investment and PPP strategy for Dubai Health Authority and very kindly supporting us on our panel during the Arab Health Conference, bringing us all up to speed on what their priorities are for now and for the next 3 to 5 years, 5 to 8 to 10 years. And all of the data and information about that is in her wonderful updated guide. This is the 2024 version of the Dubai Health Investment Guide. We are very privileged to have this limited edition hard copy. It's available online now. You can download the link on the Health Authority website, and it's available on our own website as well. Now, the important thing about this guide and why this guide is so useful for the local and international private sector is that it provides a whole wealth of information, slides, diagrams, data about priority services, mental health, cardiology, diabetes, gap analysis in terms of where there is an undersupply in the community, where they need suppliers to come in, plug those gaps, where they want to see centres of excellence in the community, and how you can work with the health authority to develop centres of excellence. I think one of the points that she quite properly made in her presentation at our briefing was general hospitals. We have a lot of general hospitals in Dubai. We have a lot of hospitals providing the same services to patients. And actually what she wants to see is more specialities, more expertise, a greater focus on delivering excellent quality services, and moving also, circling back to the conversation that we had earlier on life sciences and research, is using those centres of excellence to also support research with other parts of the life sciences ecosystem. So the Health Investment Guide is important and critical for not only the existing community but anyone new that wants to come in to the community to deliver services. You need to understand the guide, you need to understand what DHA wants of the delivery by operators in the health sector.
And I appreciate that it was a look not only at the gaps, but also looking towards the future population of Dubai. They've plotted, they've looked, they can understand where the future needs will be and anticipating those, because the population changes, things develop quite quickly here, and so planning for the future needs of Dubai. And I think that is a very insightful part of the project. And you spoke in part one about the new drug, or the new Emirates drug establishment. And I just wanted to loop back slightly on that, because I did get a chance to talk to Dr. Fatima, and she was quite inspiring about how, we've worked so long with the Ministry of Health and Prevention under their regulatory guidance, and how they're really the purpose of carving this out, the regulation and the registration and the oversight of the life sciences industry is to enhance it, to ensure that it's more robust than just a department under a wider framework, but that they have a chance to expand its capabilities. I feel like she's approaching it a bit of not a regulator, not a government authority, but a bit of a startup and an incubator of ideas. And I'm quite inspired by what this new entity will be able to deliver. And so we've heard talks of overhauling the processes, dealing with the pain points of how pricings are determined, and how long an application takes to be handled, and looking at taking that energy that we see elsewhere in terms of use of digital technologies in government, and the overhaul of systems, and bringing in the stakeholders and having those conversations. I see that happening with the new EDE, and so I definitely think that's a watch this space if you're in the life sciences industry, and because we expect some pretty significant change, and they sound like they will be mostly for the better, if not all for the better.
It's a remarkable opportunity for the UAE to overhaul its system of drug registration and diagnostic and screening tools that are available not only for practical clinical settings, but also for research as well. If there's one thing the UAE are good at, it's doing things quickly, and once it recognizes a problem, it fixes it. So Dr. Fatima and Dr. Thani and the rest of the team are a remarkable group of individuals. I'm sure they will tackle this very quickly. They will create a new institution that is not only going to be fit for practice, fit for purpose now, but fit for purpose for a long-term vision and strategy.
Fantastic. And I think with that, maybe we just highlight our law update that came out in coordination with Arab Health. There we have quite a few articles about genomics. Even in Bahrain, we talk about the program there. I did an article on all the SFDA updates that we've seen in the past year, and they just keep growing. It's about a full-time job just to stay on top of the regulations, but I'm not complaining. The movement and the change, as you have said, across the region have, I think, been quite positive, quite good. With the transformation that's happening in the kingdom, the new PPPs that are coming out of the kingdom, we're seeing a lot of move from strategy to actual implementation of that strategy. So quite a watch the space, as we like to say, and we will certainly be updating our law updates and client alerts as these new developments occur. Thanks for staying tuned.